Okay, so baseball's in full swing. We want to go over a quick foundation of what our athletes should be doing to stay healthy on the baseball field. Upper extremity health is huge, as always, for baseball players, and overuse injuries continue to be the leading mechanism for injuries in our baseball players. So if we don't have one, we want to make sure that all of our athletes have a sound foundation of where to start for upper extremity health. So we'll go over a few quick, easy exercises that can get you started, and then you can build upon that from there.
So to start our baseball warm-up, we like to start with some soft tissue work. We're going to foam roll those lats. That's the back side of you. Then we'll work our way up to the tricep, which is the back of our arm. We're going to finish up by foam rolling our pecs, right? Get the entirety of that upper extremity loosened up. To foam roll the lats, you're going to lay perpendicular to your foam roller, up in that shoulder joint. You're going to roll down the back side, coming back towards the shoulder, using those legs to propel you, working your way up to that tricep, putting that extra weight on there, getting that arm nice and relaxed. Then you'll go parallel to the foam roller for the pec, putting that arm out at an angle. You're going to roll back and forth across the front side of that shoulder. So we have all these big muscles relaxed, warmed up, ready for the next portion of our treatment. Now that we've gotten the upper extremity muscles foam rolled and relaxed and ready to go, we're going to work our way through a mobility drill for baseball players. Now for baseball players, it's specifically important to incorporate the entirety of the upper extremity, including the wrist, elbow, and shoulder, because of the dynamic nature of baseball. So we're going to get up onto all fours. You're going to reach all the way through, being sure to flex that wrist on the reach through, and then push all the way towards the top, bending that wrist at the top as well, and going through complete ranges of motion, challenging the entirety of the upper extremity and creating mobility throughout. So we've done our foam rolling and our mobility drill, and our muscles and joints are now ready to be challenged through a complete range of motion. With our band, we're going to work our right shoulder. We're going to step on it with our left foot. You're going to turn the hand all the way over as if you're trying to grab something out of your left pocket with your right hand. Then you're going to pull across your body, turning the wrist as you do so, and getting all the way towards the top, trying to only move the shoulder and wrist, right? So we're really focusing on that wrist action for the baseball players, get a little extra wrist and elbow care in while challenging the shoulder in this pattern. Now this pattern mimics the deceleration portion of the throw, making it extra important to strengthen since it's not something we do naturally.
All right, so that was obviously a very brief and condensed version of what we need to be doing to keep our upper extremity strong and healthy. As injuries or as issues pop up, we want to make sure that those are thoroughly assessed. So while these are great routines to start a foundation, if you are having elbow issues, wrist issues, shoulder issues, those need to be assessed by a medical provider. But these are a great place for our healthy athletes or our athletes trying to maintain and stay on the field to start.